When it comes to the clinical assessment of the patients, things we want to consider are the history and symptoms of the patient, certain physical exam findings, laboratory values, and also vital signs, as these can come into play, especially during echocardiographic assessment of the patient. Are they symptomatic or are they asymptomatic? That is a major differentiator in whether you would intervene on a valve or not. If the valve is severe enough that it's affecting the patient negatively in their quality of life, versus if it's not even interfering with their quality of life or causing them symptoms, this is a major differentiator. So I would ask myself, are they having dyspnea on exertion, fatigue, or anginal symptoms that may be caused by other things such as coronary disease? I try to discern if there are symptoms caused by the valvular disease itself. Next, we consider physical exam findings. Is the patient having signs or symptoms of volume overload? These would include inspiratory crackles, pitting edema, jugular venous distension, or even weight changes and weight gain. Lastly, we'll look at laboratory findings. Is the BNP significantly elevated? Are there any signs of kidney or liver dysfunction with elevated creatinine or elevated liver function tests? Are there new oxygen requirements? In very severe cases, and typically more cases of cardiogenic shock, is the lactate elevated? These are all important non-echocardiographic factors that go into the clinical assessment of the patient. A couple other factors that are relevant here are looking at the blood pressure and the heart rate during your assessment. One thing to note is that an increased heart rate will cause an increased mitral valve gradient, so we need to note the heart rate at the time of the exam. Severe hypertension can also affect how the gradient looks through the aortic valve. Also, hypotension and hypertension can change the MR or AR severity, whereas hypotensive states may make a regurgitant lesion look less severe, and hypertensive states will increase that pressure gradient back through the valve and could make that valve look a lot worse and more regurgitant. So we need to keep in mind both the heart rate and blood pressure at the time of the assessment.